if a parent feels pretty strongly that their child should qualify under the autism eligibility, there's a few things they can do. I definitely recommend whenever autism is in question that they ensure an ADOS has been completed as part of the school's evaluation. So the ADOS is the Autism Diagnostic Observation Schedule. And that's like the gold standard, right, for diagnosis, which yes, schools don't diagnose, but it's also really the gold standard for schools to determine whether or not a student, truly does exhibit autistic-like characteristics. So if the school hasn't done an ADOS, they should first and foremost request that. And the fact that the school's already completed their evaluation also opens up the door for IEEs, right? So parents can choose to then allow the district to do it, basically complete the ADOS themselves, or they can opt to have an IEE at that point. So those are kind of two options in one, making sure that all the components to the evaluation have been completed to include the ADOS, and then they can request an IEE if they're in disagreement. And part of that disagreement could be that the district failed to do the ADOS. And or another piece that's really important is for parents to be informed. So making sure that they have a clear understanding of what Ed Code says, like what would qualify a child under autism, what would qualify a child under, for example, other health impairment. That's probably the most common eligibility I see when a student, may have autism outside, but they're not qualifying them as autism in the school. What might qualify a student for emotional disturbance? So if families aren't privy to that information, asking the district to review that, like pull it up on the screen, or if you're in person, like provide that information to the parent and read through it so that the parents clearly understand why the student may or may not qualify under autism or whichever eligibilities they are qualifying them under.